Hi everyone, my name is Barbara Thompson. You know, when I had my surgery 8.5 years ago, there's something that all of us who had surgery around that time used to say, and that is, oh my gosh, what if I am the one person that weight loss surgery doesn't work for? Well, we have found over the years that there is a whole lot more than just the one person that surgery might not work for. You know, Dr. Alan Whitgrove, who's a past president of the American Society for Metabolic and Bariatric Surgery, said in an interview a couple of years ago that there are about 5% of patients, for whatever reason, either the surgery doesn't work for them or they don't work for the surgery. You know, I was kind of happy to hear Dr. Whitgrove admit that for some reason, for these patients, the surgery just doesn't work. For reasons over and above what they may be doing to try to reach the weight that they want. You know, all of us hear that cliche, weight loss surgery is only a tool. But I don't think many of us are really prepared for how difficult it is to keep weight off after we have lost it. You know, we'll regain a couple of pounds and then we'll think, well, oh well, I'm not worried about it because I've been in weight loss heaven and the pounds have been falling off, and heck, I'll be able to lose those pounds at any time. Well, that's not the case. And some of us continue to regain the weight. And then what happens? We become so ashamed. Maybe we haven't dealt with the issues of emotional eating or whatever the reason may be. We find that we are ashamed, but we don't take the next step to do something about it. You know, there definitely are people that weight loss surgery doesn't work for, that for some reason it fails. And there are a lot of physical reasons why that may happen. It may happen that the stoma is too large, or the pouch is maybe too large, or you know, maybe these people have very low metabolisms. Whatever the case, there are definite physical reasons over and above those emotional eating reasons that we always think of, over and above the reasons that we think of that come out to, oh, it's all my fault, I am such a failure. You know, in the May 15th, 2008 issue of my newsletter, I refer to research that was printed in the General Surgery News. And this research talks about revisional surgery that weight loss surgery patients go through. And it estimates that 10 to 15% of patients need revisional surgery. Now, what I think is really impressive about that is, notice the percentage has gone up from years ago when Dr. Whitgrove said it's 5% to the General Surgery News article, which is saying it's 10 to 15%. But you know what I think? I think that percentage is very, very low. I think that there are thousands of people out there who have not reached their adequate weight loss, or they have regained all of their weight. And I know that there are many of you who are watching this video that applies to. For whatever reason, you have regained a large portion of your weight. And most of you are too embarrassed to go to your surgeon and say, hey, wait a minute, something is wrong here. Let's figure this out together. Let's look at if there are physical causes for this to have happened, or maybe I'm eating too many carbs and I'm feeling too hungry. Whatever the reason, this is happening, and let's figure this out together. Let's not just assume this is all my fault because I have this problem. You know, so many of us ignore that there are definite reasons for this happening. And we keep thinking of ourselves as these failures. So there are three things that I want you to do. First of all, I want you to realize that you are not alone, that there are thousands and thousands of people who are just like you who have regained your weight. I want you, number 2, to stop feeling guilty. This very well may not have been your fault. We don't look at obesity as a disease. This is a disease that we have, that we share, that we need to find cures for. And sometimes weight loss surgery isn't the cure alone. And the third thing I want you to do is to find out what's wrong. I want you to go to your doctor and address it together and not feel that horrible embarrassment in doing that. You know, you are not a failure. I want you to hold your head up high and realize that this is really a tough journey. Take care, everyone, and I'll talk to you again in a couple of weeks. Bye.